We are here. Hello. Hello, hello. Let me get rid of this. Delete. Okay. I have every reason to believe that we are rolling. So I hope everybody's doing well. What's up? What's up? For those who don't know me, my name is Imari Ventura Rochez, and I am a licensed speech language pathologist, educational administrator, and special needs parenting coach. What's up? Hello, special needs super moms. I hope everybody's doing well. And we are on Facebook Live. Hello, welcome to the group if you're new. If you've always been here, it's nice to see you again. If you're watching the replay, thank you. It is Thursday. It is February 20th, 2025. In the Northeast, many kids have midwinter break, February break. In New York City, school district has been closed this week for midwinter break. In Massachusetts, some districts have been closed for midwinter break. Some Connecticut districts have had time off, and so that's really nice too. I've been working. I have gotten minimal time off, but I'm glad to be here, and I love to work, talk to parents, and be a part of everything that we do. It is freezing cold in the Northeast. I mean, freezing. It is so cold, so cold. I keep saying I can't wait for spring. I'm so happy when it gets here. How do you guys feel about that? And how do you feel about eggs being almost $15? Okay, but let's get off of that. Today, we're going to be live talking about thrush, thrusts, and ties. Oh my. Thrush, thrusts, and ties. Uncomfortable tongue conditions. So if you have a child with any one of these conditions, either they suffer from thrush or tongue thrusts or a tongue tie, let me know. You can message me privately or you could put it in the chat, whichever one you want. I'm interested to know who is struggling with this. Now, thrush and tongue thrusts and even tongue ties are evident with adults. However, I will be talking about children today, okay? I'll be talking about these conditions within the pediatric population. So, hello viewers, how are you? So I want to make it very clear because I'm going to be talking about some things that are very specific to children, okay? These conditions can be evident in adults. We can also see them in children. However, just for today, I'm talking about them in the pediatric population, all right? So let's get started. You guys, I wore my heart earrings for you. I wore these on Valentine's Day. I went out with my family. We were looking for hibachi, but we didn't know where, because we went out with the kids, and so we wanted the flames and the fun and the noise and the bang and the clang and all that. My son and my daughter loved that, but we couldn't find it. So we went to regular Japanese sushi, and I wore these. These are my Valentine's earrings, my love earrings. So I wore them for you guys because it's the month of love. Okay, so I hope they're not too distracting. Okay, thrush, thrusts, and ties. So let's start out with thrush. Thrush is a fungal infection that can cause white patches, soreness, and irritation in the mouth. Okay, if you see me glance over to the side, it's just because I have my notes ready that I prepared, and I want to be accurate. So thrush is a fungal infection. All right, you can see it on the surface of the tongue, and everybody's tongue, what is normal is variable. But when you see thrush, this is not, dehydration. This is not anything that is within normal limits. This is patchy, it's white, thick. You can see sores sometimes on it, and it is very irritating, very uncomfortable for the person who has it, okay? Tongue thrusts. Thrusts. Different from thrush. Thrust refers to the movement of the tongue, okay? Constantly hyperextending forward. A tongue thrust is a habit, all right? It has to do with the muscles that affects swallowing, speech, and even dental alignment, all right? So if a tongue thrust is not dealt with, it will continue. All right. If the muscle if it keeps working that way and it's not intervened upon, it will keep working. You guys, I have a client who's 33 and she is suffering with this, and it is affecting the dental alignment. So tongue thrust, it refers to a habit. Ties, tongue ties, okay, is a condition where the tongue movement is restricted due to a tight or a short frenulum, which affects feeding and speech. I'm going to lift my tongue and show you what a frenula is. You see that? That's my frenula. All right. So a tongue tie is when it's tight, it's restricted, it's pulled back, and it's short. Pulled back meaning the tongue can't move freely, can't move from side to side, it can't extend out and up and do a lot of things because the muscle's so tight. That's a tongue tie, and it affects feeding and it affects speech. I'm going to tell you something, okay, just to give you a little preface. My son, who's going to be 4, so cute, he is tongue-tied. My son is tongue-tied. So when we get into the description and the signs and symptoms, I'm telling you as a mom, because my son is tongue-tied. He's still tongue-tied. When he was a baby, I breastfed both kids for a year. I breastfed my daughter for 11 months. I breastfed my son for 13 months. And he just drank that milk up. It was so painful to breastfeed him because his tongue tie affected the latch. It made it so painful, okay? So a tongue tie is a condition where the movement is restricted because the frenulum is short. It's tight and restricted. All right, let's get into it. I'm going to describe to you the condition, some signs and symptoms, when to go to a doctor, and what you can do at home. Because what good is a Facebook Live if I'm not giving you strategies to use at home? We got some viewers. Put a thumbs up if you have a tongue-tied child. If you have a child with a tongue tie, let me know. You know, I'll tell you, I wasn't immediately aware of my son's tongue tie. I had a lactation consultant come to my house within the first week of bringing him home. She was so sweet. And she, looked in she said, he's tongue-tied. And then I looked and I said, oh, he is. So if you have a tongue-tied child, let me know, okay? Or if you have a tongue thruster, or if you yourself are a tongue thruster, let me know. Okay, starting out with thrush. Remember, that's fungus. That's a thick white coat on the surface of the tongue. So it's a fungus caused by yeast that affects the tongue and the mouth. We're talking about tongue conditions today, but the yeast that's in thrush, that's a part of this condition, could be around the mouth, as well as the sores. The little pocks and sores can be on the tongue and around the mouth, okay? Signs and symptoms. White, cottage cheese, meaning like lumpy, soft and lumpy. Patches in the mouth or in the tongue. I'll say that again. White, cottage cheese like lumps and patches in the mouth and on the tongue. That's why I say, ladies, This is very different from anything that you've ever seen. Sometimes you see a white tongue because of dehydration or nutrition. Could be a vitamin deficit, right? Or some people's tongues are just lighter than others. But when you see thrush, it's like cottage cheese, white and lumpy. Soreness, redness, or discomfort while eating and swallowing. Moms, if you go back in the archive, I did a Facebook Live on feeding, mealtime struggles. I think this was, it was either last month or December. I can't remember. I think it was last month. Mealtime struggles. You got to check out thrush. You have to rule that out. If your child's not eating, remember in that Facebook Live, I said pain trumps everything. When your mom said, if he's hungry, he'll eat, that's not true. If a person is in pain, they won't eat. And you have to figure out what is the source of the pain. In figuring out what is the source of the pain, you got to check out the tongue for thrush. If your child's not eating, rule out thrush. It's the first thing. It's a simple look at, okay? So soreness and redness or discomfort while eating. Because imagine your tongue is a very important part of the phases of a swallow. You use your tongue to propel that food back, to strip the spoon, to do a whole lot. And if there's patches and sores, you're limited with the tongue involvement. Okay. Cracking at the corners of the mouth. That's part of thrush. Cracking at the corners of the mouth. All right? So overall, we're talking about a white, lumpy, cottage cheese textured tongue. We're talking about sores, right, on the surface of the tongue and perhaps in the rest of the mouth, and then cracking at the lips. This is remarkable. This is not something that, oh, we didn't see it. No, you would notice this because it's so far from normal. You would notice if a child has the signs and symptoms of thrush in their mouth. Okay. I know I said we're talking about children, but I worked in the nursing home with adults in rehab, and I did a lot of feeding therapy for 3 years when I was younger. And I saw a lot of thrush. It is remarkable. It's not something that you can miss or mistake for anything else. Okay. When to seek medical attention. And this is important because a child will not eat if they are in pain. Pain trumps everything. If they are in pain, they won't eat. Number 1, if symptoms persist more than a week. If it's been more than a week, you have to dig a little deeper and seek medical attention. Infants. Number 2, infants, if they refuse to feed due to discomfort. I said they won't eat if they're in pain. 3, if you or your child have a weakened immune system, right? Because this is bacteria. Okay? So that's a key point. Children get bacteria in their mouth all the time for a variety of different reasons. They could be remember, it's a sensory response to stuff your mouth, to suck on things. I get a lot of calls from parents that the children are suffering from pica, putting different things in their mouth, okay? And so thrush is not as impossible as we think. It can happen, okay? Bacterial infection in the mouth is very, very common. All right, so know the signs and the symptoms. And if they have a weakened immune system, they're not eating and they're refusing food, you have to go to the doctor, okay? Okay, caregiver support at home. What can mom and dad, what can caregivers at home, grandparents do when thrush The yeast is on the tongue. Maintain good oral hygiene. Sterilize pacifiers, bottles, and breastfeeding equipment. When this is evident in babies, you've got to heat it up. It has to be boiled. You have to sterilize it. When I had babies, I had something like something I put a lid on and I plugged it in and I pressed the button and it got hot and it sterilized everything. So you're going to have to sterilize all of the oral toys, materials, if thrush is the diagnosis. Offer cool, soft foods for comfort, okay? It's very difficult to have anything that's hard, anything that's chopped solids when thrush is evident. Use prescribed antifungal treatments if recommended by a doctor. I don't even know, and please put it in the chat. I don't even know if there's over-the-counter medication for thrush. I don't know if there's over-the-counter interventions. We do have a pediatrician in the group. I don't know if she's watching. But, however, please, your doctor should prescribe medication for treatment. Usually antifungal, antibacterial medication, you have to do the whole course of it, right? For it to work and for the bacteria to die. I also want to say, for older children who are not on bottles and pacifiers, you have to throw away that toothbrush. Anything that's going in the mouth, you have to throw it out. Toothbrushes are disposable, so throw it out and use a new one after treatment, right? That even goes for a cold. If a child has had the cold or a flu, throw it out, okay? I remember years ago I had strep throat and I kept using the same toothbrush and then it just wouldn't go away and get better. And then I had to throw out my toothbrush. So throw out the toothbrush, all right? So this is thrush explained. Next, let's get into tongue thrusts. Tongue thrust. Remember, that's a habit. Okay? It's a habit. It's a muscular habit. A habit where the tongue pushes against or between the teeth during swallow or speech, affecting dental and speech development. I told you I have a client now who I'm working with this issue, and she would really like to finish her braces, her treatment plan, but it's affected because of the tongue thrusts. So we've been working together, and there's been a lot of improvement. Okay, this is important, and this is a referral. This was a referral from the orthodontist. So when you think of tongue thrust, think of it as a habit, okay, of the movement. We do myofascial therapy. Well, I'll get into the intervention. So, what are the signs and the symptoms of tongue thrust? Difficulty pronouncing the S sound, okay, or z, sh, sh, or ch. Okay, all of those sounds don't exist in every language, but some of them do. So these they're called fricatives, but these sounds, difficulty producing them, there's potential there that there's a tongue thrust. Okay, open bite or misaligned teeth. Okay, so when we talk about an open bite, we're talking about here. Your alignment, there's really a certain angle that we have to look at in order to assess that. The dentist and the orthodontist or speech pathologist could really get in your mouth and check out your dental alignment. But it's very obvious when the tongue has been hitting the teeth over and over again. Usually, because I said, If this is something, it's a habit. If it's not intervened upon, if nobody brings awareness to it and shows you correct placement of the tongue, it keeps going. So oftentimes when adults come in for intervention, this has been going on for a long time already. Okay. Frequent mouth breathing. Hello. Mouth breathing. We are supposed to breathe out of our nose. We are supposed to inhale from our nose. So breathing in from the mouth is an indicator that something's wrong. In all situations, breathing out of the mouth, inhaling through the mouth, usually there's a problem of some sort, whether awake or sleeping. We're always supposed to inhale through the nose. That's what it's made for. That's normal respiration. Okay? So when there's mouth breathing, that's a problem. Usually it's really always a problem. And there's a couple different things to rule out. But tongue thrust is one of them, when there's mouth breathing. Another last sign and symptom, prolonged thumb sucking or pacifier use. Ooh, I got upset with a mom because she kept the pacifier in for too long, and the child needs speech therapy because of a pacifier, and it's something that totally could have been avoided. Okay? All right, when to seek medical attention. If speech issues persist beyond early childhood, so there's a developmental beginning and end to speech sound production. If a child continues to make errors in their speech past 7, really, the research gives up till 7 years old to acquire all of the sounds that we're supposed to acquire. When this goes after 7, this is beyond early childhood. If it goes beyond that, we got to check out tongue thrust. We have to rule it out. We have to assess for tongue thrust. Okay, if dental problems develop, so 7, 8, we have some adult teeth, but not all of them. But we can see as the teeth come in, we could check out their alignment. And if the tongue is consistently colliding right against those teeth, it will show. It will show. And we have to rule out tongue thrust. If swallowing difficulties impact eating habits. So you may see sometimes with a tongue thrust, the dribbling or pocketing food in the cheeks or dribbling food from the sides of the mouth. Okay, this is a swallowing difficulty impacted from tongue thrust. Okay, what can you do at home? Encourage proper tongue placement exercises. Hello, this month I released myth busting tongue thrusting. Myth busting tongue thrusting. You have to buy it. It is a fact sheet. A lot of people don't know about tongue thrust, but when an individual is tongue thrusting, it is a problem. It is a problem. It causes so much damage. It's like wreaks havoc in the mouth. Our little tongue, this little muscle, can wreak so much havoc in the mouth. So I have a fact sheet. That was February's digital download. Myth busting tongue thrusting. A fact sheet with at-home targeted exercises. You have to do the exercises. There is a $2,800 course for speech pathologists in New York City next month in March, all for 3 days, all about myofascial exercises, the exercises needed to teach our clients that have tongue thrust. They work. They work. Okay? So encourage proper tongue placement exercises. Like any muscle, the longer you've been doing it that way, the harder it is to break that problem. So you have to get the awareness cognitively. Bring my tongue up, bring my tongue up. Put my tongue on the bumpy ridge, bumpy ridge, bumpy ridge. There's a whole lot of intervention and awareness and exercises that have to be completed when there is a tongue thrust. Work with a speech therapist for retraining techniques. Retraining techniques. With any muscle, it has memory. You work it. And if you're doing it the wrong way, you have to break the habit and retrain how to do it the correct way. And it's so evident with children and handwriting. There is the right way for letter formation. When you watch a child who's been taught the wrong way to form letters, and then you try, and then you say, no, not like that. You give them corrective feedback and show them how to do it the right way. It is so difficult. It is so difficult because once you train a muscle how to do something and then you're teaching it the wrong way, it's very difficult to break that habit and get it on track. So work with a speech language pathologist for retraining techniques. The earlier we intervene, the better. Okay? The earlier, the better. Before the child has really ingrained that that movement, constantly colliding, constantly hitting the back of the teeth with the tongue. We can break it and teach them the right way for better feeding and better speech sound production. Why is speech sound production so important? Because it's your intelligibility. In connected speech, you can tell, maybe at the single word, it's not a big deal, we don't hear it. But string all those words together, and it's like, huh? So it's very important to connect with a speech language pathologist to intervene and get the therapy for tongue thrust. My client now that I'm seeing for tongue thrust, in 6 weeks, we made a whole heck of a difference of progress. We made a lot of progress to the point where her orthodontist said, wow, and asked for my information. Next, number 3, what can you do at home? Reduce prolonged pacifier or thumb sucking habits. I'm only going to say it once because it's it's a difficult topic to talk about. You have to get rid of that pacifier after the first year. You got to get rid of it. You are doing more harm than good. I'm sorry to tell you. And the thumb sucking too. You have to get rid of it. Sucking is a reflex. Babies, infants need to suck. 1 year is generous. I would say 10 months. Get rid of it. I didn't give my kids pacifiers because it's a very difficult habit to break when you need to take it away. And it does so much havoc. It's so difficult. It does cost tongue thrusts. It facilitates. It helps better just because of the movement, right? It can make breastfeeding very difficult. It impedes on dentition. You can tell the kids who've been sucking, their teeth show it. And then you have this thing in there's plastic in their mouth. You're not giving them an opportunity for spontaneous speech. You're blocking it. You're blocking opportunities for spontaneous speech. You're not allowing them to develop an articulation. There's a lot of reasons. Moms, get rid of the pacifiers. Get rid of it. Next, number 4, what can you do at home if your child has a tongue thrust? Provide positive reinforcement for correct swallowing patterns. So I understand some children have tongue thrusts. perhaps even some of the children of the moms in this group, the viewers who are watching this on YouTube. Okay. If you don't know what to do, purchase my digital download, Myth Busting Tongue Thrusting. There is a lot of misinformation out there. I have the right information for you about tongue thrusts, okay? And targeted exercises. Targeted, meaning it's like a bullseye. This is the issue. This is the exercise to remediate it. This is it. Download the digital download. Do the exercises, okay? If your child does it correctly, if they're able to demonstrate awareness of their tongue position, give them positive reinforcement. Give a sticker, right? It's not advisable to give food, give a cookie or something. It's not advisable to build those associations, but you have to give them positive reinforcement. You could give them a hug, a kiss, a sticker, okay? A turn at a game. So you have to do that and reward the positive, the muscular behaviors we want to see that will help them. Hi, Shirley Ramos. I see that you tagged yourself in this, and so I'm so glad. Moms, so these Facebook Lives on these topics are here in the groups, okay? You can go to, I think, the files. I don't know where. It's in here. I also upload them into YouTube, okay? If you want to watch it again, if you want them all in one place, or you want to share it, if you want to share the link with somebody who's not in the group, because the group is confidential and private, okay? These are moms with kids who have special needs. It's not an open group. There are also professionals in here. It's a confidential group. So, however, if you would like to watch this again at some other point, you can always watch them on YouTube at Communication Resources. That is the name of my speech private practice. Okay, last one, tongue tie. Tongue tie. Remember I said a tongue tie is when the frenulum is restricted. It is tight. It is short. Okay? And the tongue cannot do a whole lot of movement. It doesn't have a whole range of motion because it is restricted by the length of the frenulum, okay? A tongue tie, the medical name for it is ankyloglossia. I have to say that slowly. I was doing some billing, insurance billing this week, and I had to use this code and plug it in as the medical diagnosis, the secondary diagnosis, and there were so many codes, and I was trying to, I did the Control F to find this one, and I couldn't spell it, and I can't even say it. But this is a tongue tie, okay? It's a condition where a short or tightened frenulum restricts tongue movement, affecting speech and feeding. I really hope a lot of you watch this because there is research to show that there's a connection between the tongue tie and ADHD. Did I just blow your mind? Because it blew my mind when I took a look at this. In a tongue tie, the tongue does not hit the top, the alveolar ridge. That's what it's called. Right behind your teeth, there's a bumpy, soft tissue. This is called the alveolar ridge. Alveolar ridge. Alveolar ridge. Under that, there is a nerve ending that is attached to a cranial nerve, which is connected to self-regulation. So many children with a tongue tie may show the symptoms. May. That's a conditional word. of ADHD. You got to look at the research. You have to look at some articles on it. I will tell you there is a connection between a tongue tie and ADHD. Okay. Because in a tongue tie, the tongue is not hitting that alveolar ridge and activating that nerve. Did you hear me? In ADHD, the tip of the tongue does not, in a tongue tie, the tip of that tongue is not hitting the top of the mouth at that alveolar ridge. In a tongue tie, the tip of the tongue is not touching that alveolar ridge. Therefore, the nerve is not activated. So a child may present as something else. There is research on tongue tie and ADHD. Okay, I just want to make that connection for you. Signs and symptoms. Difficulty latching while breastfeeding. That's what I explained to you. My son has a tongue tie. It wasn't difficult to latch necessarily, but it was painful. Okay? So you want to rule that out. Speech articulation issues. For example, trouble with sounds. For example. Okay? My son does have that issue. He says "gwale" instead of "girl." Okay? But these are specifically some of the speech sounds that a child has difficulty with. Okay? Limited tongue movement. Difficulty sticking out or lifting the tongue. So I have a client who's tongue-tied. We work on hyperextending, bringing the tongue out and lifting it. Okay? Because this is restricted, we have to do it. We have to practice. We have to train that muscle. Despite the anatomy, we have to teach the muscle what to do. And then last sign and symptom, gagging, choking, or trouble with certain solid foods. You know, the feeding can be difficult when they're babies. However, when the food becomes more difficult, chopped and semi-solid and solids, it will show if there's really a problem. So gagging, choking, or trouble with certain foods, you have to rule that out. Remember, like I said, if a child is in pain, they will not eat. Okay. When to seek medical attention. If feeding difficulties impact weight gain, that's what your pediatrician is looking at. They are looking at that growth curve. Okay? They are looking at the growth curve. When it comes to feeding, what is important is weight gain. The other thing that we look at is aspiration. Is the food going into the mouth, esophagus, and stomach? Bing, bing, bing. That's what we want. However, with some children, food goes into the mouth, trachea, and lungs. Dangerous. Okay? These are the two biggest red flags with feeding difficulties. The weight gain, which happens over time, but immediately what we can sometimes see is aspiration. Food going into the airway and then the lungs. Okay, so that's a when to seek medical attention when the child is having difficulty gaining weight. If speech development is delayed, if it's delayed and there's no other reason why, your child can have a tongue tie. Why aren't they developing these sounds on time? Why aren't they developing them at all? One intervention is auditory bombardment. which means you just keep saying it. You just keep saying it to the child again and again and again and again. The sound, la 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 la, in different, in isolation, in different words, in different positions of words, with all that, and still they can't produce it. So if speech development is delayed, that is a reason to seek attention. If tongue restriction affects daily activities like eating, speaking, oral hygiene. Sometimes, depending on the severity, right? Because there's always a severity. There's mild, moderate, moderately severe, severe, profound. Depending on the severity, sometimes the tongue tie, it's not so bad. Sometimes it doesn't affect eating, speaking, or oral hygiene. Sometimes it doesn't. But if it does, which I would say is anything more than mild, then you have to seek attention. I'm so glad that you guys are liking this live. Thank you. Great. And so, lastly about tongue ties, I want to talk about caregiver support and what you can do at home. Also, remember that these Facebook Lives are Q&A also. So if you have a question, please put it in the chat and let me know what is your question, okay? And I will answer it for you live. Okay, caregiver support at home. What can you do at home about a tongue tie? So try different breastfeeding positions for better latching. I did that with my son. I did. Because of it was painful for me. I got the pillow. I tried different things. I brought him up higher. I changed my position. I put a pillow on my back. I did different things. I had some help from the lactation consultant, and she was able to step back and look at me and different things like that. I looked in the mirror to get some feedback, and it helped. It helped a lot. And then after a while, it wasn't so painful anymore. So try different positions for a more comfortable latch. Next, perform tongue stretching exercises if advised by a specialist. Hello, you have to consult with the speech language pathologist to know what these exercises and stretches are. You can, even with reduced movement, even with restricted movement, due to a small and tight frenula, you can still do exercises to make it work, okay? Seek a consultation for a potential frenectomy. What does that mean? Okay, that's when they snip the frenulum. There are a lot of schools of thoughts about this, snipping the frenulum. There's research to support why to do it and research to support why not to do it. I'm not having that conversation this evening, all right? And I'm not, you will have to schedule a consultation with me so that you can know what I think about it. But I'm telling you, that is an intervention. I will say that the last point is support speech therapy if needed, okay? I will say that if the family or there's an adult who called me, living in New Jersey. I'm not licensed there, so I didn't see her. But there's an adult who called me a couple of months ago who needed speech therapy because they were going to snip her frenulum. Yeah. There are, I know babies who get this procedure done. Up until adults are getting the procedure done. At whatever time in the lifespan an individual decides, or the caregiver decides for the individual to have the frenulum snipped, I believe that there still has to be a follow-up with speech therapy after the surgery. Okay? There has to be follow-up with speech therapy because they've modified the anatomy. But then it's like, how do I use this muscle now, right? Especially if it has been elongated for me, because that's essentially what happens. The tongue gets a little bit more mobility, range of motion. It can go up, down, around, back and forth, because they have extended the tissue. So this in a nutshell has been thrush, oral infection, thrusts, a bad habit, and tongue ties, restricted tongue movement, in all together. If you are living in Massachusetts, anywhere in Massachusetts, if you are living in Connecticut, anywhere in Connecticut, if you are living in New York State, anywhere in New York State, those are 3 states that I mentioned: Massachusetts, Connecticut, New York. New York, Connecticut, Massachusetts, and you, your child has any one of these conditions, thrush, thrusts, or ties, I am available for a consultation to discuss it with you and potentially provide therapy for the child. Okay, I'll say that just one more time. Hey! I'll say that just one more time. Thrush, thrusts, and ties. If you are living in New York, Massachusetts, or Connecticut, and your child is experiencing thrush, tongue thrusts, or a tongue tie, please schedule a consultation with me, and I will talk about it with you and potentially pick them up for therapy on the caseload. Okay? Let me know your questions. You can email me if you want to keep things confidential. That's fine. Let me tell you this, because I've had my ZocDoc is for new patients who don't know me, who are not part of this group, who've never met me, but would like to meet with me to, your insurance is already in there. You've identified me as in network or out of network, and you want services, that's fine. Don't book me through ZocDoc if you have access to me. If you know me, book me through Calendly, or people have been using my website to communicate with me also. So that's fine. I prefer that more than a Facebook. I've gotten some communications from Facebook Messenger. That's not secure or HIPAA compliant, so I don't need to use that. This has been great, everybody. Please watch the replay, and I'll talk to you. Go ahead. And I will talk to you later. Thanks so much for joining in. Take care.